I'm not confident that we can directly gap the synovial surfaces of the sacroiliac joint. Certainly not easily and not in the majority of patients. However, there are some useful manipulation variations for the lumbar spine that can help to optimize the general efficacy of HVLAT in this area in specific cases. So in particular, when targeting the LS junction and the pelvis, we can use the combined vectors to lock all the rest of the spine to the LS junction. When we do this, in this case, it will be adding right rotation as the torso goes in this direction. That right rotation combined with side bending and flexion will have the effect of drawing the sacrum in this direction. So that's the force that will be transferring to the pelvis from the lumbar spine. I can encourage or block that movement when I do a manipulation. As the sacrum goes in this direction, if I apply force to the upper side posterolateral angle of the sacrum, I can help to cavitate possibly the SI joint, but more likely the LS junction. So I'm essentially blocking that movement that is getting driven into the pelvis by the locking of the upper segments of the spine. So to demonstrate what this looks like, first we need to palpate the LS junction and ensure sufficient locking of the other segments of the spine. Initially, I'll produce rotation. I'll then draw the patient towards me to flex the spine. I'll just adjust your head to that comfortable position. Keep a grip here. Palpating the LS junction, I can also check and add a range of motion into side bending. From here, I'll ask the patient to straighten the bottom leg and let this leg relax over the edge. I'll step over that leg to apply further tension and locking through that region of the spine, further flexing the lumbar spine here. I can also add a little bit of flexion with this leg. I check the location of the PSIS here and follow the lateral border of the sacrum. In this case, I'm blocking the upper side of the sacrum, so that angle of the sacrum. I need to put my arm in the correct position that I can apply force through the sacrum in this direction. I get the patient to take a deep breath in and relax as they breathe out, applying that force more or less axially along the length of the femur with my contact there.